Welcome to my channel. In this video, I'm going to talk about something that happens not so often, but sometimes when it happens, it's usually very deadly. And this is about medical emergency on air. Recently, we have record of at least 1 or 2 Nigerians who had medical emergency on air traveling from Nigeria to UK, and it ended up very deadly because this passenger passed away. Now that brought memories, and sometimes it's because people don't understand that such things could happen and what they ought to do. I personally have experienced a near medical emergency situation on air, and it wasn't funny. That's because I realized what it was and I could act on time. I was on flight from US through Paris to Malaysia. It was a very long trip. And so from Paris to Malaysia, which was over 14 hours flight time, at some point I was feeling dizzy. I was fainting. I knew I was fainting and I needed to do something. So I called the air hostess. It looks to me like they were not quick. I had to get up and lie flat on the floor before they got to me. And the next I knew, they had put on oxygen, and before you know it, by the time I got back to my senses, I was good. And thank God it was managed well. Firstly, because I understood what it was or what was coming my way. Secondly, the air hostesses were able to help. Now, the air hostesses are trained. They are able to help you, even though they are not paramedics. So we get it clear. They will be able to help to the best of their ability until you're able to get medical help. But it's important that you know and prepare ahead so that when you're having any strange situation on air, you're able to identify it, call the attention of air hostesses, and you could do something, either to help yourself or to help someone who needs the help. I've had training on first aid. Having worked as a caregiver is one of the major trainings that we need to have to be able to support that. So I understand and I know how to do simple things like first aid, CPR to patients that are having some challenges, if they faint and you needed to resuscitate them. So I understand, but not many understand that. So I want to use this opportunity to talk about simple medical emergencies that you may experience on air, or you find someone experiencing it and you're able to help. One of them is nausea and vomiting. It's one of the most common ones. Many times because some pass, they react to travel motion sickness and it's worse on air. The other one could be fainting attack, like I said I had. The next one is some respiratory tracts, issues. People are struggling to breathe, probably because the altitude is so high and so on. And then the very severe ones are seizure, cardiac problems. Those ones are usually more complicated. But it's good you identify them and you know about them when you're traveling. You want to be on the international space, you need to know simple things that can help save your life. But nausea and vomiting, it's very common. I've seen people have that. I've never had that myself, but I've seen it. You see them throwing up, uncontrollably. What you need to do, if you know you're prone to it, is to make sure that you keep rehydrated. You drink water before the flight and during the flight. Usually when you're having too many vomiting, it could throw your system into shock if you lose too much water. So keep hydrated to help yourself. The other one is you don't have to eat all the food. If you don't understand the food, don't eat it. In this case, you have to come along with your own snack, food that you're used to. Some of the food you see in the airplane are so strange to us, you've never eaten it before. And so some people may react to it by throwing up. So if you don't understand the food, please don't eat it. Find something else to eat. They will have snacks, they will have drinks. There is something that can keep you going until you get to your destination. But if you do have that, if you eventually have react to that, vomiting on air, you can call for help. The air hostesses will help you. There's usually some disposable pads in the pocket of your seat that you can use to, throw into if you're vomiting, so you don't mess everywhere up. You may also choose to sit on the aisle, so it's easy for you to go in and out to the bathroom or to the toilet, okay? So you don't have to inconvenience everyone. And I'm sure the air hostesses will also be able to help. Now, if you're fainting, which was the experience I had, you need to be able to identify that you're fainting, you're losing consciousness or breath, The first thing to do is to make sure you release if you're wearing belt, take it off. If you're wearing tie, take it off. Just let loose the things you're wearing so you can begin to have fresh air. The next one is lie flat. One of the common mistakes we make, even not just on air, is that when people are fainting, we're busy trying to help them to sit up. No. When people are fainting, what you need to do is to help them lie flat, raise the leg up so that blood will flow back into the head. And they will get more oxygen in their brain to be able to kickstart again. So lie flat, raise the leg up, and see if blood will flow back into the head to help your neighbor or yourself. Like I said, when I realized I was fainting, I called the air hostess. I pressed the button for them to come, but I thought that it might take too long. I went straight out of my seat on the aisle and I was flat there before they got to me. You see how knowing what to do helps to save your life. Don't try to manage it yourself. It's not an easy thing. It may get more complicated than you could. If you're sick before traveling, consult your doctor. Make sure that you're well enough to travel. And if you have routine medication, hold them with you and put your timer so you know when to take them. So you're not exposing yourself and every other person on the flight to a risk. The New England Medical Journal documented that 1 out of every 600 commercial flights do record some form of medical emergency. So you can see it's something we need to pay attention to and not allow ourselves dying with. If you're still watching my channel at this point, I would like you to please like, share and subscribe. And do not forget to ring the notification bell so you will get first-hand information whenever I release a new video. Now, going back to my topic, it is very important that we help to save other people's life, save a life, and make international trip more memorable so that there will be less medical emergency. If you know what you need to do, you do it. If you know how to help others, you do that. And in that way, we will be a safer community to live in. Now, one of the things you can do to help yourself is, I had mentioned, stay hydrated. The other one is, if you're prone to any of this medical emergency situation, don't drink alcohol. They serve you a lot of drink. Some people will drink and some get even intoxicated. Don't drink alcohol. Don't do caffeinated drink so that you'll be able to, hold yourself together. The other one is, try and rest before your trip. Sometimes you work so hard, like my trip to Malaysia, I was so sure that I was part of my problem. I worked so hard several days before the trip, and even on the trip, I was still working. I was going for a conference and I needed to prepare for my session. I told myself if I had slept very well before the trip, if I had rested on my flight from US to Paris, I probably wouldn't have the situation that I had. So you need to rest. You need to plan for your trip. You need to be ready to manage your situation. Again, if you're on the flight, learn to move around. After sitting for a long time, stand up. When there is no turbulence, you walk about, exercise. You can also do some sit exercise. Raise your leg up and down and try to let the blood circulate well. The other one is that you can take deep breath. It helps a lot. It helps the blood to circulate, the oxygen to circulate more in your system. There are simple things you can do to help yourself. And you should stay calm. When things happen, you begin to panic, you're worsening the situation. Whether you're the one experiencing a medical emergency or someone by your side, stay calm. And God willing, you'll be fine at the end of the flight. Thank you for watching. Please like, share, and subscribe to my channel. I look forward to seeing you in my next exciting video.